Hi, this is Charlie Zeese from Only PVC Pyramids. I'm really happy today to have an old friend of mine who is from Omaha, Nebraska. We met about 10, 12 years ago while I was living out in Omaha. Her name is Ann Francis. Ann is a tremendous healer and a great personal friend. She's done a lot of work for me that we're going to talk about as we go through this interview today. But what we're going to be talking to Ann about today is pyramids and distance healing. Ann is a practitioner of Reconnective Healing, which is the work of Dr. Eric Pearl. She's been doing this for over 10 years now and has really become very proficient at it. I met her in her early days when she was great, but as we'll get into here in a few minutes, she did some work for me just yesterday, and I've had some amazing results. So I've been wanting to have Ann on for several months because she has helped my significant other on any number of occasions with some issues that she's been dealing with, and she's had some wonderful results as well. And Ann has a wonderful way of describing the reconnective healing and what her thoughts are on why the pyramid is so valuable in accentuating and amplifying those benefits. So, Ann, thank you for joining us today, and we appreciate your being here.
Well, thank you for inviting me.
Ann, why don't we start by letting you do a brief introduction to yourself, and I'll give away one of my trade secrets that you're a musician as well. So talk about your background and how you got into the work that you're doing now with Reconnective Healing.
Well, I actually have a music degree in piano and studied the piano and played other instruments for many years. And it was later in my life that I happened to be listening to Coast to Coast. And Dr. Eric Pearl was the guest on that particular radio show. And I was just fascinated by it. And I thought, this is something that I've been interested in really my whole life, but never knew where to find it. So the next day I ordered his book, which is called The Reconnection, Healing and Heal Yourself. And I got the book and read the book and decided to take his seminar out in Los Angeles. And this all happened very quickly between August and September when I went out there and took the course for a weekend. And it was just really, really easy for me to do this. And I just, again, felt that I was interested in helping others, and this was a way that I could do that. And so I started practicing on my friends first. And some of them were very willing and some of them not so willing, but it gave me an opportunity to get good at what I was trying to do. And so I think I met Charlie at about that time when I was just getting started in all of this, and he was having an issue with a broken ankle. So he came over and we worked on that, and he was very much farther than I was in a lot of the metaphysical information. He was light years ahead of where I was, but he understood what I was doing, I think, and it did fix the ankle problem pretty well at that time. He felt that he'd broken it, and he was still kind of walking on it, which, wasn't so great. But after we did a session, he felt that the ankle had definitely improved and had gotten back to a place where he knew it was going to get better. So,
well, and it did, and we'll talk about some of that a little bit more here in a few minutes too. But tell us what if you can encapsulate the Dr. Pearl's theories and teachings into a couple of minute summary, how would you do that?
Well, he is very interesting. He's a chiropractor by his education. And that's how he kind of came. He was already working with patients when he discovered this type of healing. And when he wrote this book, it was very interesting because if you look at the book, nearly on every page of the book is the word fear. And he realized right away that it's the fear that holds us back from being all that we can be, so to speak. And when we get rid of that fear and those kind of constraints, we can have a much healthier life all the way around. And the healing a lot of times is not just a physical thing like a broken ankle, but it could be that it's a chronic issue that's maybe caused by a spiritual issue or an emotional issue. We don't really know, and we don't really have to know. And when we do the healing, sometimes it's better not to even know what the problem the person is fighting against, because we're not there to diagnose anything. We're there to bring the light and the information to them so they can get better and get rid of whatever the ailment is. And so we don't really care. We just want that person to be able to rise up and get rid of the issue that they're having.
I wanted to comment on the concept of fear here for a minute, because to me, in my life, as I've grown to learn and experience over time, fear is nothing more than feeling a disconnection from your higher self in many respects. So, I mean, I guess that really ties in a lot with the whole idea of reconnecting perhaps with your higher self and your more perfect self.
Exactly. Fear is, when you're in a state of fear, you're totally disconnected from anything that's going to help you to be the best you can be, so to speak.
Right. So the reconnective healing process, if I, can tell me if I'm wrong, would really be a process of trying to reconnect with your higher self, your more perfect self. I know a number of years ago, I went through a meditation, a series with Dr. Joe Dispenza, and one of the meditative exercises that we did was to try to visualize our higher self and see ourselves connecting with it. So it seems like there's a similarity in that process there, and really perhaps the reasons we experience what we deem to be the negative aspects in our lives may in fact just be due to this disconnection from our higher selves. Am I on the right track?
Yes, I think you are. And I think you can almost picture that higher self as a hologram of your perfect self. Some people refer to it as the Adam Cadman, but we all have this perfect expression of ourself, or our best expression of ourself. And when we get off of that, we want to try to get back on. And so with Reconnective Healing, we're just trying to reconnect you back to that best expression of yourself. And it's there. It's just that you've been disconnected from it. And it really, it's not that difficult to reconnect to it. It's just that people maybe don't know that they can, or don't understand that that's all it takes. I saw early on that this was just what I considered fast food medicine, because when you reconnect, it's just boom, it's there. And a lot of people are a little bit unsure. And so in the early days, I'd say, well, I think if you go home and go to bed tomorrow morning, you'll notice that maybe everything's better.
Right.
Because for a lot of people, it was very hard to just have something happen that quickly and instantaneously. And sometimes whatever the ailment was, it was hard to discern that anything had changed right away. a broken ankle is an easy thing to know, is it better or not?
Right.
But sometimes if it's an emotional or spiritual thing, you're not always so sure about that. And sometimes it's that emotional or spiritual disconnection that's causing then the body physically to be weak somewhere.
Well, that's certainly been my experience, and coming from metaphysical teachings, we are taught that a subject matter called mental equivalence, that really it's our belief systems that end up manifesting in our physical experience as some sort of a disease or a broken ankle or whatever it might be. So yeah, I think that's absolutely spot on. So I know initially, Ann, you started off, and when I came to you, I think you had only been you mentioned you'd gone to see Dr. Purr and gone through his sessions. I think you'd been doing this for maybe less than a year, but I came
Probably.
to your home, and in fact, I think I was in the very room that you're sitting in now, where we first met and did
Right.
this conference.
Exactly.
So you were doing that exclusively, at least as far as I know at that time, with the person physically in your presence. But tell me how you
Yes.
went from having the patients there with you physically and made that leap, so to speak, to doing distance healing.
Well, I think at first I needed the confidence that I could do this with somebody being right there in the same room with me. And that's one of the reasons that I begged every family and friend and anybody I could get off the street to try this, because I felt like before I really practiced on somebody that I didn't know who was counting on something good happening, I really needed to have the confidence to know that I could do this well. And so then after I got enough confidence in working with somebody up close like that, they would come in and just lie down on a massage table on their back. And in this kind of healing, you never touch the person. It's all just bringing the light and the information to the person. And maybe acting as the observer. And I know there's a lot of people that have read things about how the observer plays a big part in what happens, what comes about. You need to have an observer there. And so in a way, I would act as the observer. Well, after I had done this for a while, I started realizing that there were a lot of people that were doing distance healing. And I thought, well, I need to try and see if I can maybe do that, because a lot of my family and friends don't live where I am. And so I first started with people that I knew.
Mm-hmm.
And I was able to help that way, just because I knew the person, I could see the person in my mind. And so that went pretty well. But I didn't have the confidence that I could do this with someone I didn't know. I thought, how is that going to work? Well, I took another seminar with Dr. Pearl a few years ago. Actually, it was in Philadelphia. And one of the main things that we worked on in that seminar was the idea of the distance healing. And we all got chances to work with somebody who was agreeable to trying it that we didn't know, because this was a real stumbling block. How do you find someone you don't know and say, well, would you let me try to practice this with you? I mean,
I think I was a guinea pig for. I think I was a guinea pig for one of your fellow practitioners.
And so yes, you were. Yes, I called you and said, would you, and you were very, very kind and obliging. But that was always a stumbling block, because it's kind of like, well, how are you going to find somebody that doesn't think you're a total nutball that would say, okay, yeah, I'll let you try this.
Yeah.
So it was a very difficult jump to make. But after I did that, at that seminar, I realized that I could do that with someone that I didn't know. I didn't do a lot of it with people I didn't know, but some, and again, it was kind of for the same reason. You kind of tended to work with people you knew, and maybe somebody you knew, but then, they'd moved or they were out of town. So at the point that Charlie contacted me about the pyramids that he was doing, and he wanted to try an experiment to see what distance healing would do with somebody under his pyramid. I said, sure, that'd be great. We'll do that. And the experiment worked rather well as far as I'm concerned. It was very successful. And I felt like the healing was so immediate that it was very likely that the pyramid did act as an instrument, as an amplifier maybe,
Right.
or something that allowed the information and the light to be more focused
Right.
on that person who is under the pyramid.
Sure.
And so it just made everything better.
It seems to, and of course that backs up, or corroborates with all of the research and the science that was done in Russia. So, maybe we ought to step back here and or get right into, I should say, some of the examples that we've had. I know that my significant other has done a number of sessions with you, and for those of you, she wants to remain anonymous, but she's a holistic dentist and naturopath, so she keeps me on the straight and narrow quite a bit in terms of what I eat and so forth. But she, practicing dentistry for 40 years, like this, her shoulder muscles and her finger muscle are aching constantly. And I'll just kind of get into the story here. Anne sent out a email to all of her friends over the holiday season last year, and said that as her gift to her friends, that she was willing to do some remote or distance healing for her friends. And Carol was just complaining about her neck and her shoulders and her fingers and all this stuff. So I said, well, dear, why don't we call Ann? And she said, well, I don't know Ann very well. And she didn't want to do it and so forth, because she and Ann really hadn't met that much when we lived in Omaha. But anyway, Ann, why don't you tell them a little bit about that
Well,
story?
actually, I've never really met Carol. I've talked with her on the phone. I know her through you.
Yeah.
At the time that you had your ankle issue, she was not here. I have friends that know her, and so there is a connection, but I haven't actually seen Carol face to face.
Right.
It's not like that. But anyway, she was willing to try this, and when I do this by a distance, I find that the healing, and this probably happens even with the person in my presence as well, the biggest part of the healing probably happens in the first 2 minutes.
Mm-hmm.
And sometimes I think additional healings happen if you just stay with it a little longer. Other things are happening that we just don't know what's going to happen when we do this. And we try not to concentrate on the problem, because that's not what we want. We want the solution. We want the best expression.
Right.
So one of the biggest challenges, and I think even if you have a pyramid, one of the biggest challenges is don't sit under there and ruminate on the problem.
That's exactly right.
You're going to get more of that. And so it's very important, I think, if you have a pyramid, to sit there and notice what comes to you while you're in a meditative state, perhaps.
Yeah.
Try to bring in what you need, not what you already have that you don't want.
That's exactly.
And I think some people are able to do this more easily than others. Dr. Pearl can do this for himself. I have not really felt that I'm very strong at doing it for myself. I feel like I need another person being my observer, or the person who is directing the light and the information.
Right.
It's very hard not to think about your problem and then bring it in, but you can do that. And I think the pyramid probably allows you to do that more readily than if you don't have a pyramid. You're just kind of, you're sitting there with the Wi-Fi in your house, and who knows, what other electronic, interferences you're dealing with. And the pyramid probably, in my mind, alleviates some of those other extraneous things you don't want, in order to get more quickly to the light and the information.
Sure, sure.
So after spending about 20 minutes, it turned out that all the soreness in the shoulders and the neck had dissipated, and the hands were not swollen any longer. And I mean, that's 20 minutes. I mean, this isn't like we spent, a whole lot of time on this.
No.
Kind of proves to me over and over how easy it is to get to where you're supposed to be. Where you're supposed to be is the right place. It's probably much more difficult in ways to get to the wrong place.
Well,
and so to get back to the right place is probably very easy. But in our minds, we think getting well is very difficult, because we've been using modes of healing that are not always that great. And so sometimes they work, sometimes they don't. Sometimes you try this medication, it doesn't work. And I think we're just a lot of times, going down the wrong path here with something that doesn't have to be that difficult at all. I think we're living in an age now where we want things quickly. We want to be well quickly. And I think, as Charlie and I were talking before, we have an Ethernet available to us now that has all the light and information in it. And I think you can picture it just by the internet you use every day in your home. And all the information that you can get now on the internet, it's incredible. But the information that's in the Ethernet is so much more. And that's where the healing information is. It's in the light and the information that's in this Ethernet, and we just need to access it. And it's just not that hard. And maybe you can eventually learn to access it yourself.
Yeah.
And the pyramid will help you, allow for you to do that, I feel. And I feel like the healing that I do is very copacetic with the pyramid healing. We're not working against cross purposes here.
Oh, no.
So
couple of comments, if I could. I mean, one, I want to make the distinction between the Ethernet with the AETHER, the field, the source field ether, and the Ethernet cable that I use to do away with Wi-Fi. But that's a cute. I think it's interesting that's a nice play on words. But I also wanted to just digress a second and talk about Carol's healing, because there's a key point that I want to make. We actually did this in almost like a unintentional, scientifically controlled test, because when we called the first time to you and you did the healing for her, everything that you said did occur, but she wasn't sitting under the pyramid. But,
I forgot that.
That's right. And so the first time we did it, the pain dissipated from her shoulders and her hands, but it only lasted for a day. And so she came back from work the next day and she said, "Oh my, I felt so great this morning, but it's coming back again. So I said, well, this is a great chance for a controlled experiment. Why don't we call Ann back and see if she would do this time with you sitting under the pyramid? So we did that, and she, as she confirmed yesterday, has not had any pain in her hands ever since that next session. So I,
Well, and yeah, it's pretty easy. You know,
yeah,
it's so easy. It's stupid. I mean, you almost it's hard for people to understand, especially people who've been sick a lot of times in their life and have chronic illness and have not been able to get rid of a chronic illness that just keeps hanging on, hanging on, hanging on. Oh, I have asthma. Oh, I have diabetes. Oh, you know, all these chronic ailments that seem to plague people. And so now the mindset is, well, I've got this and I'm just going to have it. I can't get rid of it because maybe you've had it for 5 years, 10 years. But the fact is, this shouldn't be there in the first place. And yes, it can go away. And I think it's just what has taught us that maybe getting well isn't that easy. But I truly have seen that it is. And I have a real strong belief system that way,
yeah.
that getting well is maybe the blink of an eye.
Well, that's right. And I might as well talk about you did a healing for me yesterday, 2 days ago, and I think it's important to talk about that. As you mentioned before, I came to you after I fractured my ankle 10 years ago in Omaha, and prior to coming to see you, I had on the whatever that foot thing is that they put your foot in when you break your
Oh
ankle,
yeah.
so forth, that I was having to go around Walmart in my little scooter because it was too painful to walk. And you did an initial session for me of 20 minutes or so, and it worked so well that I came back and did a full reconnective healing. And quite honestly, I think it probably healed itself. I mean, within 80 to 90% of perfection in that next session. But what I have figured out over the years and began to realize again in my pyramid work, I've talked about this in some of my other videos. I did notice that once I got the geometry right on the pyramid, that I noticed that there were some things going on again that were improving my ankle, and also the pain in my right knee, which was due to compensating for that old injury. So, in preparation for this, I said, you've been doing all this nice work for Carol, and so I want to try it again for myself. So you did a healing for me yesterday, and I might, just tell people how that went, because up until yesterday afternoon, even though there was still no pain in that ankle any longer, when I would twist my ankle and turn it in a circle, I would hear a popping sound every time I would do that, twist my ankle around in a circle. And within 2 to 3 minutes of starting the session for me, I began to feel that the tingling sensation that I guess I was experiencing in the ankle suddenly changed, and it was a much more cooling sensation, radiating, a peaceful radiation that was going on. But then after about 5 to 10 minutes, I started feeling like something was moving inside my ankle and adjusting or something. I couldn't explain it. But when I finished the session and we chatted, I started moving my ankle back and forth again. And guess what, folks? No popping, no cracking, nothing. This thing had apparently readjusted. So you might want to talk about what you think may have happened there.
Well, I think the universe responded to the fact that your ankle wasn't quite right, and just put it back into alignment where it needed to be.
Right.
Again, the more perfect presentation of yourself.
Yeah.
And it's very likely that, I mean, we didn't work very long on that ankle. We just did one session on that. And a lot of times it might take more than one session to get worked all the way through. But I think we had it down to the place where you were pretty happy. You know, I think you were kind of surprised at how easily that went away, because even though you had told me about other things that you had done in the past that were metaphysical, and I think you had even some kind of a subscription to something to keep yourself and your kids healthy. I think this was a little more astounding than anything you had experienced before so quickly.
Well,
like that.
That's right.
And I will say that I don't know about with the distance, but when I've worked on clients here that are present in the room with me, one of the more outstanding things that happened was I actually heard this sound. And I, at the time, was standing probably 10 feet away from the table. And I thought, my goodness, was that me? Was that her? What was that? Because it was a sound I'd never heard before. And I have pretty good ears, having been in music most of my life. And I thought, gee, what was that? Well, after the session was over, I asked her, I said, did you hear something while we were doing this? And she goes, oh yeah. She said, that was the bone in my nose. She said, when I was 12 years old, I broke my nose helping my dad with a horse. And she said, that bone just snapped right back into place.
Oh, well, that's probably what happened.
That was not one of the things she had come here for. She had forgotten. She was in her 50s now, and she'd totally forgotten that she'd broken the nose. It'd been like that for the last 40 years, so she wasn't expecting anything to ever happen with that.
Yeah.
But boy, we both heard it, and she felt it, and she said, yeah, look how straight my nose is now. And of course, I didn't really notice that her nose was that crooked before, but she knew it. And so it did actually make her presentation just visually got better as a result of that bone snapping back where it was supposed to be.
Sure.
And I think when we did this thing with you, you didn't hear anything, but you felt it lining up.
That's right. That's right.
But I'm just saying sometimes it can be pretty, outstanding what happens. And fortunately, she wasn't hurt by it in any way. She didn't feel any pain. Right. But boy, that was a case where a bone went back into place. And it was sort of interesting. She brought her daughter to me later, and I worked with her daughter. And even though there wasn't that noise, her daughter told me later that her nose had been broken and it fixed. And she said, I'm breathing better. So the problem she had with her nose, again, wasn't so visual as it was actually keeping a bad situation going with her breathing.
Right, right.
So anyway, they were pretty happy about that. I said, gosh, does everybody in your family have a broken nose? It's pretty dangerous being around horses. Because they lived out on a ranch out in western Nebraska, and it's like, definitely, So it's just a lifestyle I'm not that familiar with, and so it struck me odd that they both had a broken nose.
Right, right.
So, but those are just some things. Like I say, I think a lot of the healing seems more subdued, and I think again it goes into more of an emotional thing that then causes the physical thing to dissipate. And sometimes people don't, those were immediate things that they knew right away, like your ankle. Right. Sometimes what it is, I had a client who had macular degeneration, and he was just very, very upset about it. And of course, we had done probably at least 2 healing sessions, and he went back to the eye doctor a year later. I mean, this is a whole year later, and they do an eye checkup for him, and he says, well, what about the macular degeneration? They said, oh, you don't have that. Well, they told him he had that the year before. And so when the medical community can't make heads or tails of it, they just kind of toss it aside. They didn't want to talk about the fact they told him. They probably felt like, well, we made a wrong diagnosis. We don't want to tell them we were wrong before.
Right.
I don't think they were wrong before. It just fixed.
Right.
And they don't know that something like that can fix. And they wouldn't have had any idea. He didn't tell them, well, I was going to see someone with Reconnective Healing, and they likely fix this. They're going to just laugh you right out of the room.
Right.
So, but the fact is, this is what happens. They kind of, when they can't explain it, they don't explain it.
Sure, sure.
Now, we don't care. He didn't have macular degeneration anymore, and that was all that really mattered.
Well, ultimately, that is what really matters. And you know, I mean, I can tell you, and you've had all these experiences with your own healing patients and clients, but yeah, it's the results are ultimately what it's all about. And yeah. You know, I know we've got a lot of left brainers in the audience as well, and I like to use both sides of my brain to figure this out. But when I experience it, that to me is the most powerful. But you know, I think you have the book there. You might be able to hold up. There's a whole book that's been done on the science behind reconnective healing.
Yeah.
It was done by another Russian scientist, Konstantin Korotkov, who has developed a technique called gas discharge visualization. So for those of you who you know still have trouble believing that we're not out here doing huckster work here, you might want to read the book on the science behind this. Just as you all know, I'm doing the science behind pyramids. So kind of an interesting segue, because I wanted to talk briefly as well about some of your other clients that, you know, maybe have used the pyramid. But, you know, before we got on the air, we were discussing the woman who interviewed me a couple of weeks ago for The Other Side of Midnight, and she had been to the Pyramid Conference in Chicago in 2016, the first one. And anecdotally, when I talked about how much weight I've lost using the pyramid, she kind of just matter-of-factly said that she had had the same experience. So you might want to tell people what you think is going on there.
Well, again, I listened to that interview that you did with her. And I guess what struck me is that she was just there kind of in a casual way. I mean, she was probably walking around these. She probably went inside them. But she didn't sit under a pyramid for the whole weekend of this conference.
No.
So I just said she was around these in what I call a very casual way.
Right.
And yet here she reports that she was able to lose 45 pounds after that.
Yeah.
Wow.
Yeah.
It just again shows me that when you get reconnected to what you need, your body is going to respond. And if that means whatever it was that was going on with her that was keeping that weight on her, it dissipated and her best expression came out, and her best expression was 45 pounds lighter, you see.
Right. That's right.
And so I think, again, I don't think she ever expected to go to the conference. She didn't go to the conference saying, oh, I need to lose 45 pounds, and I know if I go there, I can maybe lose 45 pounds. And she didn't ruminate on that.
Right.
And then she connected, and it came to her, and she got where she needed to be.
Yeah.
So I don't know that you need to sit under that pyramid all that many hours a day. You might not even need to do it every day. But I think that if you start not feeling well, or you're feeling a little upset, or things aren't going well, get yourself under there and get yourself back lined up before things get too far off the path.
Right. Right.
Most of us right now are living in a place where we're so far off because we haven't been able to get back on that, it's a big leap. But
Yeah.
I think if you have access to a pyramid, you can probably keep yourself in the state you want to be in without too much muss or fuss. Once you get where you want,
That's
you
right.
can maintain. I think it's a huge maintenance thing, not to let yourself go too far astray and end up in the hospital or something like that.
Well, that's right. I'm just thinking about this. I know you bought one of my early pyramids for your sister. I got to get you one as well. So I'm going to do that for you. But what we're discussing about right now, the interdimensionality of the pyramid, the interdimensionality of the work that you're doing. I mean, I'm coming at it and have from a scientific standpoint, looking at the torsion physics and so forth. I'm going to be speaking in a couple of weeks at a conference where we're going to be talking to people from India who do pyramid meditation and so forth. So the whole idea of interdimensionality, runs through both the healing process and the role of pyramids, I think, in achieving that. But I wanted the viewers to know a little bit about some of the information and perhaps the interdimensional nature of some of the work that you do. You mentioned to me that you feel, for example, that you may be connected to some specific spiritual entities, beings, whatever, that are, in a different dimension. And you might even want to, I would love for you to tell people, I mean, I'll tell them to begin with, that you told me over a year ago when I was first learning about the proper geometry of these pyramids, that you had gotten information that I was on the right track. So I'm just going to kind of open it up and let you talk about all of that, because some of this stuff is fascinating and it is very germane to our discussions.
Well, I've been really fortunate my whole life to know really good people like yourself, and it's true. I've been really blessed that way. And one of my very good friends here in Omaha is Lori Sasson, and she's a psychic intuitive and a very, very good one. And through her, I have been able to communicate with a very dear friend that passed away only about 11 months ago. In fact, his birthday is this Sunday, and his family is coming here, and we'll be celebrating his yahrzeit when they're here. Anyway, after he passed, I was very interested in having her see how he was doing if he passed over, how he was doing on the other side. And basically, she was just blown away because she was so readily able to talk to him. And she said, I've been doing this for 30 years, and most of the time it's very hard to talk to the people or understand it. The connection isn't very good and this and that. But she said with Mike, she said, I can easily hear him. She says, I can even see him. She said, I know when he's in the room here with us. And she said, not only that, he knows everything. You can ask him any question and he knows. Right. And I said, oh my goodness. I said, well, he was a bright individual before. He has a degree from the Wharton School of Business. And I said he was a expert, bridge player. That was his hobby. And he was, mentally very strong person. But I said, he didn't know everything, Right. And so some of the questions that we were asking him would have been things that he never would have known before. I'd known him for over 20 years, And it's like, no, no, so he's able to access wonderful information. And if we ask him the question, he can tell us about anything we ask.
Right.
And so Charlie had shown me about a week or so ago this hieroglyph that had a pyramid on it and some other symbols. And he told me what he thought the translation was. And I said, well, I'm going to get together with Lori and we'll just ask Mike and see what he says this is. So we did. And the first thing he said is, well, you've got to read it from right to left, not left to right. Okay. So he gave Lori the translation. And basically, the translation was very, very close to the one Charlie already had. And if you read it right to left, the very first symbol on this hieroglyph was that Russian pyramid, or the pyramid with that angle that we all know is really a very, very good angle. And so that was kind of exciting, to get that information about that particular hieroglyph. And we've been able to ask him other things too. And he's also able, if something isn't quite right, we always ask him to help fix it.
Mm-hmm.
And he's able to fix quite a lot of things.
Oh, sure.
So that's quite exciting too. And I never would imagined that I would ever have access to somebody I knew before that now is able to do all this. I just never would have known. But it makes things a lot more interesting than they used to be. That's for certain.
Oh, sure. Well, to follow up on the point on the hieroglyphs, I have to expand on that just for a little bit, because you didn't tell, or
well, I was going to let you tell the rest of it.
I'm in the middle of moving, and my significant other has tons of books. And so 2 weekends ago, just as I had gotten this information on the hieroglyph from a young man in Australia who I interviewed last week, and you're now my second interview I'm doing on my YouTube page. But that's where we got this from, and I sent it to you. Well, lo and behold, the Saturday before I'm beginning the interview with Michael, I'm unpacking all of these books that my significant other has, and what pops out but a book on understanding hieroglyphs. And I said, wow, is this interesting? And what's the very first thing that I do? I open the book, and I open it to a page that has the first two symbols on the top line of this hieroglyph. And I said, wow, what a coincidence this is. And then you tell me that when you showed him, or he read this, that it had to be read from right to left. And yesterday afternoon, and this is after our session, immediately after our session, I picked the book up again, I open it to another page, and what do I find? I find the entire hieroglyph, not a photograph, but an ink drawing of the exact hieroglyph that I had in photograph form, except it's in a mirror image. So apparently what Mike was telling us, in saying that it had to be read from right to left, was that it was a mirror image, and somewhere or another on Bing, or somewhere or another, that photograph, we were seeing the mirror image of it, and therefore it had to be read in reverse order. All just way too fascinating for words, but and more than just mere coincidence in my view. You can't be doing these things, as I continually do now under that pyramid, and not realize that these things are happening because I'm asking the universe about my desire to have solutions and answers to these questions that I'm trying to discover.
Well, and then backing up a little, before we had the very first session with Mike, I was on the phone to you, which was we're not on the phone all that much like we used to be.
Right.
But we happened to be on the phone when Lori got here for the session. And I told her, I told you I had to go because she was here. And then I said, oh, Charlie was on the phone. And I said, he's doing these pyramids. He's found a new dimension that seems to be more right than what he thought before. And she looked at me and she said, yes. She said, it's the right one. And she knew that it was.
Yeah.
And I shared that with you.
You did. You did.
And then also we did in the very last session, when we talked to Mike about the hieroglyph, we also asked him, where did this pyramid come from? Because Charlie had told me that there were, seemed to be a lot of these around in different places. It
That's
wasn't
right.
Russia.
I haven't disclosed all that yet to the world, but I'm going to be doing that in August at the Cosmic Reset Conference
But
in Virginia.
Mike told us that this particular pyramid came from another planet. It didn't just start here on Earth. Some entity brought it here.
Right.
And I think they knew it was the right one. And they brought it here because it was one of the tools that they needed to stay healthy, perhaps, or centered, or be able to do what they needed to do. They needed that.
Mm-hmm.
They needed that help. They knew that would keep them lined up, so to speak.
Well, exactly. And, it's not a surprise to me that this knowledge is coming from other places, because this knowledge has been stored physically in the geometry of these pyramids. And in my view, I can't think of any other way to understand the building of the great pyramids around the world other than through extraterrestrial contact.
I don't want to interrupt, but the crack just came on the wall, which was Mike saying what you were saying was right.
Oh, okay.
Putting the information behind it, yeah. So yes, it's stored. The information is stored. Yes.
Well, I hope we're not getting too far out there for people who are listening.
And so
if it is,
but what you have to realize is the healing is just only one facet of information.
That's right.
It's probably the information that most people need the most, because so many people have health issues that are not being addressed.
That's right.
But once you get healthy and you get beyond that, I mean, what else do you want to know? Well, probably by getting yourself in or around that pyramid and asking the questions, you might get the answers. Well, because the information is there, you see.
Well,
so I mean, we're just basically dedicating this particular session to healing, which is a main thing that most people want for themselves.
Sure.
But I think there's a vast amount of information out there that has to do with, a myriad of subjects.
Oh, sure. Absolutely. Absolutely. But, this is probably a good place to start to wrap up a little bit.
Okay.
I would assume that it would be all right for people to get in touch with you. I think, I know the work that you do is just amazing, and you're not giving yourself enough credit. You've told me about people's healings that have just gone beyond my wildest imagination and belief.
There's a lot, yeah.
And I totally agree from my own experience that using the pyramid in conjunction with, if people can't come to you directly, that this may be a great tool for enhancement of distance healing. And so I'm wondering if it's all right for people who might be interested to get in touch with you.
Certainly. And I think it is really also important to realize that there may be other information that they want to know. And that pyramid may be the vehicle or the instrument, the tool that will allow them to find other information. that they've been wanting to know about?
Well, you're well. I totally attribute everything that I'm learning about pyramids now to the pyramid itself. And ever since I got the geometry precision much more close to perfection late last year, the information that's been flowing into me has just been nonstop, and it's hard for me to keep up with it. So
For your community that does have the pyramids, I would just say, would recommend one little thing to them. And of course, you've done many, many YouTubes on this issue, but you want to be well hydrated.
mhm.
You'll get better results in the pyramid if you're well hydrated, I feel.
That's an excellent point. And
Can't say enough about that.
yeah, well, and to reiterate, you need to be in the proper frame of mind because you don't want to be doing a pyramid meditation or a healing inside the pyramid unless you're focused on that you want, not what you don't want. So,
Right.
those are all
Exactly.
prerequisites. So, your website is Reconnections by Ann. And what I'll do, I'm going to put up a link so people who might be interested in getting in touch with you can contact you through your website. And Ann, I want to thank you so much for being with us today. And now people know at least a little bit, in addition to my pyramids, as to where I get some of my information. Uh, I think it's interesting that when I was at the conference in Chicago last year, that when I'd go around, I was a newbie, and so I'd go around and talk to the other pyramid makers and say, "Where do you get your information? How do you figure this stuff out?" And they were all getting it from other dimensions. So I think for
Yeah,
anyone
absolutely.
who is not comfortable with that, I almost feel sorry for you because you're missing the whole interdimensional nature of what Ann does and what I'm doing as well. So I hope that this is not offensive to anyone. Uh, it's just the way the world seems to work, and I'm totally or becoming increasingly comfortable with it. And it seems like, Ann, you are too, because
Oh,
your healing abilities have grown enormously as your confidence and knowledge of these truths becomes clearer to you over time. So, anyway, if you have any parting comments before we leave, Ann?
well, I think we've covered it pretty well, and I thank you for having me on your video today.
Well, thank you for being with us today, and I thank all of you for listening, and you have a great day.
Thanks so much.